This is a presentation of Victimizing the Self from pages 89 to 98 in the Body Remembers Casebook, Unifying Methods and Models in the Treatment of Trauma and PTSD by Roberta Rothschild. Victimizing the self occurs when a traumatic incident or incidents influence the self-concept, causing one to believe that they are a victim. This can increase risk of victimization and is not because the individual wants or is looking for it. Victimization leads to a loss of what Rothschild calls tools, which are reactions and resources to prevent these acts, and can even lead the person to feel like they are victimizing themselves. In this case study, TA redecision therapy and Gestalt therapy were used, as well as psychopharmacology. The client, Roberta, an electrical engineer who had survived childhood leukemia, came for therapy because of a depression brought on by a failed attempt at promotion. The first steps taken in this case were to refer Roberta to a psychopharmacologist, who confirmed major depression disorder and prescribed antidepressants. While adjusting to these medications, daily stabilization was their focus. They knew they were ready to proceed to the next step when her inner critical voices were quieted, but not silenced. They then set the stage for therapy, identifying two main difficulties: Roberta's vulnerability to outside criticism and her criticism of herself. To address these concerns, they discussed and agreed on TA redecision therapy. Her therapist also addressed and normalized that she may feel criticized during therapy and want to give up, and suggested a contract that neither of them give up in those moments, and instead they utilize these moments and work through them. With the stage set and a contract signed, they moved ahead. This meant setting goals and discussing natural happenings in counseling, such as bouts of depression and how this may feel like regression. Acknowledging these situations and setting goals allowed for a solid beginning point and realistic expectations. They also used this time to highlight her strengths, her organization, and logic. Roberta had two main goals: to stop feeling abused and to be kinder to herself. Together, they agreed on body awareness, working on her internal dialogue, and attending an assertiveness training course. Roberta initially expressed anxiety about talking to herself in therapy, as she hated herself and did not know what she would say. Roberta understood the how, but she feared the process. It took her time to calm down and begin talking to her child self. She did make changes in talking to herself, using things such as sweetie instead of calling herself words such as idiot. These changes led to bigger things, such as using a retreat day for self-care. She became more relaxed and occasionally reported that she was able to enjoy things again. Roberta found it very difficult, near incomprehensible, to forgive herself. However, there was one session that showed a change in her posture while in the critical parent chair. She was shrinking instead of becoming an imposing figure. Asking her what she was feeling, she said that she felt young. So the therapist brought in another chair and had her shift chairs, and interviewed this new ego state. This caused Roberta to remember how she had become the class clown by being self-demeaning as a child. She had begun this behavior during her recovery from leukemia, when the kids were making fun of her appearance. However, this self-deprecation continued long after her hair had grown back, and she had forgotten to stop. This was a turning point in Roberta's therapy. Roberta had realized that her inner critical voice had developed to protect her. This allowed her to begin and eventually forgive her inner critical voice and change how she talked to herself and this inner critic. All in all, Roberta's therapy lasted 2.5 years, during which time her medication was monitored and eventually tapered off. Roberta herself reported that the assertiveness training was a very helpful addition to therapy, and that it helped her to feel like she was able to continue being nice while still getting her needs met. Roberta made some large changes in the last 6 months of therapy. She became kinder to herself and expected kindness from others. This led her to quit her job, as she realized things were not improving and not going to improve. Roberta and her husband also began couples counseling and began to work on their communication. Roberta attributed TA redecision therapy and Gestalt therapy as the foundation for all the changes she managed to make.